Hi, so in this video, I am going to go over cranial nerves. So let's get started. So cranial nerves, these are the nerves that emerge directly from the brain, including the brain stem, in contrast to spinal nerves, which emerge from segments of the spinal cord. So in layman's terms, you have the brain, and then connecting the brain is the spinal cord all the way down the spine. So there are some nerves which are spinal nerves that are coming out of the spine, and then there's nerves that are coming out of the brain, which is the cranial nerves. So for the exam, you do need to know each of the nerves. You do need to know what number they are. You do need to know what each of them do. Okay, so here is here's the first six cranial nerves. So let's go over each of them. So the first one is the olfactory nerve. This is the only nerve, I believe, that involves this like smell. So over here, if you look at this picture right here, olfactory number one, this is the nose, to help you to remember this. So one thing that would maybe help you to remember, I would think okay, factory, I would think about chocolate factory, and I love the smell of chocolate. So that's like a small way to help you remember that olfactory is smell. Optic, which is sight. So this one is about your vision. So this is about your ability to see. Then you have the next one, which is ocular motor. So over here, if you see over here, the ocular motor number 3 is this nerve right here that is affecting these muscles right here. So the ocular motor nerve is responsible for moving the eyelid and the eyeball and adjust the pupil and the lens of the eye. It's very significant because I would say there's three of them that involves the eye. Okay, so ocular motor moves the eyelid and eyeball by adjusting the pupil and the lens. The trochlear also moves the eyeballs, but differently. What it does is that it sends nerve impulses to the superior oblique muscles, which are among the group muscles that rotate the eyeballs in their sockets. So these particular muscles. So one thing that will kind of help you to remember this is I would think, okay, motor, eyelid movement, eyeball, because you drive a car, it has a motor. Then I would think trochlear. That's when you have to know that it's involving the specific muscles, which is superior oblique. So you have to be aware of that. So trochlear, the way it moves the eye is by sending impulses to the superior oblique muscle, which are among the group muscles that also rotate the eyeballs in their socket. Okay, so which is, like I said, this is a trochlear right here. Then you have trigeminal. So trigeminal is this one right here. All right. So trigeminal is the facial muscles, which includes chewing, facial sensation. So if the patient has a loss of chewing, their trigeminal nerve is affected. And the trigeminal nerve is the 5th nerve. You have to know the numbers too, okay? Then you have abducens nerve. So the abducens nerve, what this does is that it moves eyeballs. So this one, it moves the eyeballs outwards by sending nerve impulses to the lateral rectus muscles. So this one's a little bit different because it's moving the eyeballs by sending the impulses through a different muscle, which is the lateral rectus. You have to know that it's that muscle particularly. Here's one thing that would help me to remember. I'm thinking about abduce. Every time that you see that word, that stem ab, or abductor, anything like that, it's always moving something, an extremity or something inward, like from lateral to inward. So that would help me to remember that abduces is lateral. Okay, so those are some that's like some techniques, you know, plus showing you these visuals. So this is the first 6. All right, olfactory, optic, oculomotor, trochlear, trigeminal, abducens. I would recommend that you stop this video right now if you're not already and write down what I just said, including write down the ways I just told you to remember this. The next list of cranial nerves is now the facial nerve. So if you go over here, this is the facial nerve right here. This is number 7. I'm sorry, number 7. So this is it right here. So see this face right here. So this nerve, it is involved with taste, tears, saliva, facial expression, sensory fibers are concerned with taste via the taste buds at the front of the tongue. So the facial nerve is the one that involves your taste buds. So you know, so you see how it's really controlling the muscles too, like these like all these muscles in the face area. Okay, so remember the other one, trigeminal, is chewing. This one is more taste, tears, and saliva. The next one is vestibular cochlear nerve, which is auditory. So the vestibular cochlear nerve over here, this one's involved with hearing. So you can see this is showing you a picture of the eardrum. So this involves your ability to hear. You know, so that's what this nerve affects. So if the question said, you know, the patient lost hearing, that means their nerve number 8 was affected. The next one is glossopharyngeal nerve. So the glossopharyngeal nerve over here is nerve number 9. So as you can see, this nerve is pretty low, like it's located towards the bottom of the mouth, right? And the bottom of the mouth is really responsible for swallowing saliva and taste as well. So this is the glossopharyngeal nerve, okay? After this, then you have the vagus nerve. So the vagus nerve it controls, so over here, this picture. So this one controls the peripheral nervous system, the smooth muscles in the GI tract. Okay, so you know this one is more involved with the GI system. Okay, so this is it right here. It's really good visual to help you. Then after that, then you have the accessory nerve. So you have accessory muscles, which is the muscles that we're concerned about with if patients in respiratory distress. And then you have the accessory nerve, which controls those muscles. So if you see over here, stretching down here, the accessory nerve, which is nerve number 11. So this one over here, this one is responsible for the head to be able to move, the head and shoulders, also responsible for swallowing as well. Okay, so that's the accessory nerve. Then lastly, you have the hypoglossal nerve. So the hypoglossal nerve, which is over here, okay, so this one was the glossopharyngeal, and this one is the hypoglossal right here. Okay, so the hypoglossal nerve is the last nerve, and this one is responsible for the tongue muscles. So this one's going to severely impair the patient's ability to speak, so their speech and their swallowing. And then you also have supplies. It also supplies the muscles of the tongue. It is responsible. This is the main one that's responsible for the tongue movements, which involves with speech and the swallowing. Okay, so if a patient had impaired, like they're not swallowing because their muscles and their tongue is impaired, that's the hypoglossal nerve, which is nerve number 12. Okay, so these are all the nerves, and this is what you need to know about each of them. And then also these are some visual points to help you to remember them. So right now I would suggest that you take some notes as I'm saying this. So after you learn, so you want to learn everything in steps, right? You don't want to just overwhelm yourself with everything at once, because then you're not going to remember this. So what I do first is that I first learn where everything is located. I learn what each of them are, right? Then I learn, then I would, okay, or I would actually, I'll probably start with the numbers of them. Then I would learn what each of them are and where they're located. Then I would learn a mnemonic to help me to remember them, okay, in that order. So here's the mnemonic. There's actually there's two, okay, because this is the order of them, but then this is not a mnemonic. Oh, sorry, this is the mnemonic right here. So ooh ooh ooh, to touch and feel very good velvet, such heaven. So right, so that's kind of like a silly way to help you remember that. Ooh, 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 to touch and feel very good velvet, such heaven, right? So that's like a way to help you remember it. That's one mnemonic. Over here, this is like another one. On occasion, our trusty truck acts funny, very good vehicle anyhow. I like that one. I kind of like that one a little bit more. I don't know. So whichever one that you feel that you would be more likely to remember, go with that one. Don't try and use both the mnemonics. Just use one of them, okay, to help you to remember them. And then over here, this is another mnemonic if you wanted to separate them by if they're sensory or if they're motor or if they're both. What I would say, you know what? Actually, let me not even say that. You should, if you can take it one step further after you got down the like I said, the first three, like the order, then what they are, then the mnemonic. If you can do the next thing, which is now to identify if they're sensory and motor or both, that would be important. The exam could ask you, the patient has the oculomotor nerve is impaired. Is this a sensory nerve or a motor nerve? It could ask you that. So this is another mnemonic to help you to remember that. Over here, some say marry money, but my brother says big brains matter more. I think that's pretty good, right? Some say marry, right? And look, there's not two S's though. But this is kind of like a simple way to, like, you match this with over here. Okay, so this is so sensory is olfactory, sensory is optic, motor is oculomotor, and so forth. Okay, so some say marry money, but my brother says big brains matter more. So that's a simple way. Like I would probably, if I was you, if I just watched this, if I saw this for the first time, I would need to listen to this or watch this 3 times minimum before I really got this down. And then I would test myself with either questions, or I would test myself by using flashcards to see if I got it down. Okay, so start with this to help you to memorize and to learn cranial nerves. Alright, so that's it, and I will talk with you soon. Bye-bye.